The sleep paralysis glitch. You wake up and find yourself unable to move, as if pinned down by an unseen weight. This is sleep paralysis, a phenomenon that happens when your brain regains consciousness while your body is still locked in the muscle atonia of REM sleep. During REM, the brain disables most voluntary muscles to prevent you from physically acting out dreams. But sometimes the waking process and the muscle release fall out of sync. The result is awareness without mobility. The immobility is often accompanied by vivid hallucinations, shadowy figures, voices, or the sensation of pressure on the chest. These experiences occur because dream imagery can bleed into waking consciousness while the body remains paralyzed. Although frightening, sleep paralysis is generally harmless and passes in seconds to minutes. It's one of the clearest examples of how slight misalignment in brain-body timing can create experiences that feel otherworldly, even though they are rooted in normal physiology. Hypnic jerks. As you drift off to sleep, your body suddenly jolts, arms flail, legs kick, and sometimes you even wake yourself with a startled grunt. These are hypnic jerks, involuntary muscle contractions that strike during the transition from wakefulness to sleep. When your body relaxes deeply, your brain can misinterpret the signals as a sign of falling. In response, it sends a surge of activity through your nerves, snapping your muscles into action as if to catch yourself from a drop. Some researchers believe hypnic jerks are a leftover evolutionary reflex. For our ancestors who slept in trees or elevated shelters, a sudden loss of muscle tension could have meant slipping from a branch. A jolt at the edge of sleep might have been a built-in safety net to prevent a fall. Today they are harmless, but the experience can be unnerving. Your body isn't malfunctioning, it's simply running an outdated protective program written long before mattresses and pillows existed. Exploding head syndrome. Exploding head syndrome might sound deadly, but it's harmless, though incredibly startling. Just as you're about to drift into sleep or start to wake, you may suddenly hear what feels like a loud explosion. A gunshot, fireworks, or a slammed door, coming from inside your head. No one else hears it, and no actual sound exists. Scientists think this occurs when the brain shuts down unevenly. As regions power down, the auditory system can glitch, releasing phantom bursts of noise. Some researchers also suggest it comes from delayed inhibition in brainstem neurons that normally quiet sensory input before sleep. It's like the brain is turning off, but the alarms are left blaring. Surveys show about 1 in 10 people experience it, usually during high stress or exhaustion. Though it doesn't cause pain, the shock is enough to flood the body with adrenaline and fear. It's a dramatic reminder that perception is shaped by brain signals, not reality itself. Sleep apnea. Sleep apnea is one of the most serious sleep issues because it disrupts breathing itself. The airway may collapse or the brain may fail to signal breathing muscles, causing pauses that last 10 seconds or more. Each time, the brain forces a micro-awakening just to restart airflow. Often unnoticed by the sleeper, these pauses prevent deep, restorative sleep. The most visible clue is loud snoring, but the unseen damage is worse: higher blood pressure, heart strain, and increased risk of stroke. Daytime fatigue can become so severe it affects driving, work, and memory. Risk factors include obesity, smoking, and alcohol use. Many cases require treatment with CPAP devices to keep the airway open. Sleep apnea shows how a simple interruption in airflow can unravel the entire repair process of sleep, making it not just disruptive, but dangerous. Sleepwalking. In sleepwalking, the body becomes active while the brain stays locked in deep, non-REM sleep. Instead of resting, the motor system partially wakes up, allowing movement without conscious awareness. Sleepwalkers may appear awake, eyes open, but their higher brain is offline. Episodes usually occur early in the night, when slow-wave sleep is dominant. Signals that should keep the body still misfire, activating movement while bypassing awareness. This leads to anything from mild wandering to complex actions like cooking or driving, all without memory afterward. Sleepwalking often runs in families and can be triggered by stress, fever, or medication. While most cases are harmless, the danger lies in the environment: stairs, sharp objects, or unlocked doors. It's a striking example of how the nervous system can desynchronize, leaving the conscious mind behind while the body goes on autopilot. Sleep talking. Sleep talking, or somniloquy, is a parasomnia where speech occurs unconsciously during sleep. The words can range from simple mumbling and nonsense phrases to full, coherent sentences. It happens without awareness, so the speaker usually has no memory of it. The phenomenon can occur in any stage of sleep, though what's said often depends on the depth. Lighter stages produce clearer speech, while deeper stages bring more garbled sounds. The mechanics come from partial arousals in the brain, where motor speech areas briefly activate while higher consciousness stays offline. These short glitches bypass the usual controls that keep us silent at night. Triggers include stress, fever, alcohol, and sleep deprivation, though genetics also play a role. Sleep talking itself is harmless, but it can disrupt bed partners and sometimes signals underlying conditions like sleep apnea or night terrors. Its unpredictability highlights how even basic systems like speech can surface during rest when the brain's regulation slips. Restless leg syndrome. Restless leg syndrome creates an overwhelming urge to move the legs, often described as crawling, tingling, or electric currents under the skin. It strikes hardest when the body is at rest, making bedtime a constant struggle. Movement helps temporarily, but the sensation always returns. The root lies in unstable dopamine signaling, which governs motor control. Many with RLS also have periodic limb movements, unconscious kicks or twitches during sleep that fragment rest. The cruel twist is that fatigue worsens symptoms, trapping sufferers in a cycle of exhaustion. RLS has genetic links, but is also tied to iron deficiency, kidney disease, and certain medications. Stress, caffeine, and alcohol aggravate it further. With no universal cure, management involves lifestyle adjustments, supplements, or dopamine-targeting drugs. It highlights how a subtle neural misfire can turn rest into torment. Bruxism, teeth grinding. Bruxism is the unconscious grinding or clenching of teeth during sleep, often powerful enough to wear down enamel or crack teeth. Many sufferers don't realize it until a dentist points out the damage, or until a partner hears the grinding at night. It arises from overactive brain signals to the chewing muscles. Stress, anxiety, misaligned teeth, and stimulants like caffeine all increase risk. Once triggered, the brain keeps the jaw on repeat contractions throughout the night. Beyond dental wear, bruxism causes sore jaws, headaches, and temporomandibular joint pain. Treatments include night guards to protect teeth and stress reduction to calm the nervous system. Bruxism shows that even in deep sleep, the body can sabotage itself with destructive muscle overdrive. Nocturnal leg cramps. Nocturnal leg cramps arrive suddenly, usually in the calf, locking the muscle in a painful spasm that can last minutes. Unlike restless legs, which urge movement, these are sharp, involuntary contractions that jolt you awake. Lingering soreness often follows long after the spasm ends. The cause stems from misfired nerve-to-muscle signals. Imbalances in electrolytes like magnesium, potassium, or calcium, as well as dehydration or nerve compression, increase the risk. Even sitting too long during the day can prime the muscles for nighttime rebellion. Frequent cramps disrupt sleep and create anxiety about going to bed. Though rarely dangerous, they reveal how delicate the balance of hydration, minerals, and nerve signaling is. Staying hydrated, stretching, and adjusting medications can help. But once a cramp strikes, only stretching or massage can end it. Catathrenia, sleep groaning. Catathrenia is a rare condition where people produce eerie groaning sounds during sleep. Unlike snoring, which happens on inhalation, catathrenia occurs during exhalation. Long guttural noises lasting several seconds. Researchers link it to a brain glitch controlling breathing rhythm, causing mismatches between exhalation signals and muscle response. It usually appears during REM or deep sleep, when breathing is irregular. Most sleepers are unaware until a partner records or complains about the strange sounds. Catathrenia poses no health danger, but the social impact can be significant. Partners may find it disturbing and sufferers may feel embarrassed. Sometimes CPAP or posture changes help, but treatment is rarely needed. It's a harmless yet haunting reminder of how sleep can sound like something out of a horror movie. Don't just watch the world, subscribe and understand it.